Okay, now let's review a very important topic, which is the tissue agnostic cancer medicines topic. This is extremely important because this refers to medicines that can be used to treat any type of cancer as long as that cancer has the particular molecular alteration that that medicine was developed for. Okay, so we're going to review the particular medicines that have tissue agnostic approvals by the FDA. First one is microsatellite instability or high or mismatch repair deficient cancers. For this one, then we have that Keytruda or pembrolizumab is indicated for the treatment of these particular type of cancer. So it is just very important that patients that are looking for options, that we test them for microsatellite instability or high or mismatch repairs deficient cancers. Same thing, mismatch repair deficient recurrent or advanced solid tumors. Uh, this approval is also for Jemperli or dostarlimab, similar than the approval for pembrolizumab. So it's also approved in advanced solid tumors that have progressed after prior treatment with other options. So very important testing for that. Then we have tumor mutational burden, right? For tumor mutational burden, when this tumor mutational burden is more or equal than 10 mutations per megabase, then we have that particular cancer has high tumor mutational burden. And in that case, then a pembrolizumab again or Keytruda can be used for the treatment of these patients once they have failed uh, other satisfactory alternative options, at least one previous line of therapy. And this is essentially just for any adult or pediatric unresectable or metastatic tumor. So very important also to test for tumor mutational burden. These will be available in pretty much just all of the NGS panels available commercially. So very important to have that. Now we move on to another important one, which is the NTRK gene fusions in solid tumors, right? In this particular case, then we have that larotrectinib or Vitrakvi. It's indicated for the treatment of adult and pediatric patients with solid tumors that have an NTRK gene fusion without a known acquired resistant mutation that are metastatic or where the surgical resection is likely to result in severe morbidity and have no satisfactory alternative treatments or that have progressed following treatment. Once again, these kind of treatments, as long as they have an NTRK gene fusion, they can be treated regardless of what type of solid tumors they have. And now we move on also to another approval for NTRK gene fusions. And this is a similar approval to the previous one, but this one is for entrectinib or Roslitrek, right? So these two last approvals are pretty much just the same. It's just different medications, one larotrectinib and the other one for entrectinib. And once again, this is related to NTRK gene solid fusions. And then we move on then to the red fusions. And with the red fusions, then we have the approval of serpecatinib. And also this is approved for patients, either adult or pediatric patients with advanced or metastatic solid tumors that have a red gene fusion and that have progressed on prior systemic therapies and they don't have any other alternative treatment options. And then we have a HER2 positive disease by immunohistochemistry. And this is one of the newest approvals that just came up in April of 2024. And as long as patients have a HER2 positive disease by immunohistochemistry, then they're eligible to be treated with HER2, or also called FAM trastuzumab deruxtecan. So very important also to test all patients for HER2 positivity with immunohistochemistry. Very important because next generation sequencing panels, many of them, they don't test for this because this is an IHC test. So very important to keep that in mind and test our patients for that. Now we move into BRAF mutations, the BRAF V600E mutation, cancers that are positive for this particular mutation and have progressed following prior treatments and have no satisfactory alternative treatment options, then they can be treated with dabrafenib in this case. So, once again, very important to test patients for BRAF V600E mutations as well. And finally, the FGFR1 rearrangements, and these are indicated, in this case, pemigatinib of pemasari is indicated for the treatment of adults with relapsed refractory myeloid or lymphoid neoplasms with this particular genes rearrangement. And that's it. Essentially, then, the main takeaway here is that every patient with metastatic cancer should be tested for these molecular markers to evaluate eligibility for treatment with these tissue agnostic drugs. Thank you so much for your attention, and talk to you later.